Good morning, good afternoon, and good evening to you all, depending on where you are in the world. Welcome to the Virtual World Data Forum session entitled Visualizing the Invisible, Registering Deaths and Tracking Mortality in the Era of COVID-19. My name is Anir Chaudhary, and I'm the Policy Advisor of the A2I program of the Government of Bangladesh, a member of the Prime Minister's Digital Bangladesh Task Force, and also an advisor to the Cabinet Secretary's National CRVS Steering Committee. My work is focused on innovation in public service and the development of interesting and replicable models of public service delivery, including decentralization, public-private partnerships, and transformation of a traditional bureaucracy into a forward-looking citizen-centric service provider. In today's session, speakers from around the world will share experiences on the role of civil registration system in counting vital events and making people visible by providing them with documentary evidence of legal identity, civil status, and family relationships. The COVID-19 pandemic has thrown a spotlight on the imperative to monitor the trends and patterns of mortality. Without this data, decision makers cannot take effective action to halt the spread of the pandemic, and COVID-19 will remain a threat to us all. I would like to share with you our experience in Bangladesh, where the need for data to understand and monitor COVID-19 has forced us to look for innovative ways of counting deaths. In Bangladesh, we're aware that our civil registration system has not yet achieved a level of performance that ensures that all vital events are registered. This is particularly true for deaths. We know little about the numbers and distribution of deaths in our country, and we are largely ignorant about the causes of these deaths. In response, in 2015, the government of Bangladesh established a whole-of-government national CRVS steering committee, chaired by the Cabinet Secretary, who is the head of the entire civil service. This ensures that all ministries responsible for administration, health, marriage, education, statistics, identity, and digitization under the overall guidance of the Cabinet Division. The steering committee is tasked to increase the numbers and births and deaths that are officially registered and to improve the completeness and quality of statistics on mortality and causes of death. As a first step, the government worked with the partners to develop a model for sub-district based civil registration in a sub-district called Kaliganj. It involves training community-based health workers to identify births and deaths, to work with families, to record the essential information required for these events to be registered, and to share the information with the local civil registration office. This means information sharing from the health ministry workers to the local government ministry workers, breaking the data silos in an unprecedented level of cooperation facilitated by the Cabinet Division. This model was so successful that now it's known as the Kaliganj model. It standardized and mandated CRVS recording practices and has resulted in a 40-fold increase in registration rates. I repeat, a 40-fold increase in registration rates in 2 years, when it was first implemented. Now this model is being replicated throughout the entire country. Bangladesh aims to register every birth and 80% of the deaths to meet the UN Sustainable Development Goals by 2030. We need to be able to count deaths in order to save lives. This is particularly true in 2020 when, like other countries around the world, Bangladesh is struggling to contain COVID-19. Death is the starkest indicator of the pandemic's human toll. We have therefore increased our efforts to track the number of deaths due to this new disease. Like many other countries, we relied initially on hospital reporting of deaths, but most deaths in Bangladesh occur in the community, so hospital reporting alone will not give us a true picture of the impact of the pandemic on our people. Thanks to the rollout of the Kaliganj model in more areas of the country now, we're gradually building a more complete picture of the excess mortality associated with COVID-19. A rapid mortality surveillance was conducted since May 2020 to support DG Health Services to collect death data for community and facility deaths, to benchmark death counts against historical numbers, to observe trends in all-cause mortality in 2020. During the current pandemic, versus historical baselines. In May and June, overall hospital admissions and deaths declined, but the deaths per 10,000 hospital admissions or discharges visibly increased compared to previous years. With a lot of private sector partners that include telecommunication companies and telemedicine companies, we're embarking on a very ambitious multi-year health data architecture that will make identification of death reporting with appropriate cause of death much easier, much more comprehensive, and much more timely. In today's session, we're joined by 4 distinguished panel members. Our first panelist today is Dr. Samira Asma, Assistant Director General at the World Health Organization, where she leads the organization's efforts to establish an impact framework of accountability to track health-related sustainable development goals through building enhanced country capacity to generate reliable data to forecast and inform public health policy. Thank you for your attention. Now let us begin.
Leaving no one behind is our collective goal. We must count everyone because everyone counts. First, I would like to underscore the importance of counting deaths and registering causes of death. This is an area that has not been sufficiently visible. We all must work together to address this with a sense of urgency, especially during this time of emergency. Mortality statistics are a mirror of population health. Civil registration and vital statistics are the bedrock of countries' health systems. 12 of the 17 SDGs and 67 of the 231 SDG indicators rely on it. Good public health decisions depend on timely and reliable data on numbers and causes of death. Most low and even middle-income countries lack data on deaths. In fact, more than 70% of deaths in sub-Saharan African countries, 50% of deaths in Oceania, and 25% of deaths in Latin America go unreported. The COVID-19 pandemic has highlighted that the state of mortality reporting is inadequate. Countries around the world are struggling to rapidly and accurately produce data on total deaths, as well as those directly and indirectly caused by COVID-19. This undermines our ability to take appropriate policy action. Measuring progress towards WHO's triple billion targets and the health SDGs bumps into what the World Bank has coined the invisible billion. These are people who are born without birth certificates, live without identification, and die without death certificates. People who, in terms of data, do not exist. Visualizing the invisible requires strong systems that can pinpoint areas and population requiring urgent interventions. Mortality data disaggregated by age, sex, and place of occurrence is a proxy measure of equity and equality. The COVID-19 pandemic has sadly demonstrated that deaths amongst the poor and marginalized are higher than in wealthier populations. Due to lack of proper registration, some are unable to prove their age, nationality, or identity, unable to go to school, unable to find work, unable to vote, sometimes blocked from inheritance rights or access social services. For example, we read the tragic stories of vulnerable populations who hastily fled the wars in their own countries only to find themselves in refugee camps without legal documents, rendering them stateless. We must never forget that behind every data point is a person with a story. Often data is the only voice that the most underserved and vulnerable have to tell that story. Despite these challenges, we also have many reasons to be hopeful. When we leverage both partnerships and innovations, we can rapidly scale solutions to save lives. For example, the Score for Health data technical package identifies 5 essential interventions with key elements to strengthen country health data and information systems. It provides key tools to address data gaps, focus on results, and deliver impact. Among such interventions is complete birth and death registration through functional CRVS. Stronger CRVS systems is the basis of WHO's mission to achieve the triple billion targets and SDGs. WHO has prioritized strengthening CRVS in collaboration with all partners, and we look forward to working with everyone here. We are now less than 10 years away from 2030, and we cannot afford to lose any more time. We need concrete actions and effective collaboration to address this lingering gap. We have the tools, we know what works, so let's close the gap. Thank you so very much.
The next panelist is Montasir Kamal from the Canada International Development Research Center, where he is the program leader for maternal and child health team. He will focus specifically on the gender dimension of measuring and monitoring mortality during the COVID era.
Hello, my name is Montasir Kamal. I'm the program leader of the Maternal and Child Health Program at the International Development Research Center, which houses the Center of Excellence for CRVS Systems. It is my pleasure to be with you here today to discuss and share with you points on the gender differentials in registration of vital events. Women and children, particularly girls, face a vicious circle of exclusion due to the lack of access to civil registration. It's well documented that the lack of birth registration leaves women and children vulnerable throughout their lives. Single or unmarried women are often legally or culturally excluded from registering the births of their children. Thus, women pass on these disadvantages to their children. And when marriages are not registered, women face barriers to accessing spousal or widowhood rights. For example, when a spouse dies, women are vulnerable to loss of income, spousal pension, and social insurance if they don't have marriage or death certificates. If for public health institutions, this represents a situation where planning is hampered by the lack of sex disaggregated data. If they don't simply know, if they don't simply have the information on women who are not registered and not in their systems, they are unable to provide services for them in many cases. So what are the barriers to registration? There are several barriers, and we can categorize them into three kind of main barriers: socioeconomic factors, laws and regulations, and exclusions in the system. So regarding socioeconomic barriers, for example, many of the registration offices are located in administrative centers that are far from where people live, especially in rural areas. And knowing how the limitations for women in many cultures and societies in terms of restrictions of mobility, restricted autonomy in terms of leaving home sometimes, and of course household responsibilities, and sometimes the lack of resources for traveling large distances. These challenges may be exacerbated if when the woman has given birth recently, so she may be recovering and certainly has childcare responsibilities in most societies. There are also the laws and regulations. For example, laws may prohibit the registration of a birth if the father is not the father or a male relative is not the one going to register the infant. Also, in many places, if the father is not named, a birth registration cannot be issued, which puts at the disadvantage unmarried women and their children. So then there are the more sort of specific vulnerable populations that are also excluded. In some countries, refugees and internally displaced persons are excluded from registering vital events. UNHCR is continuously calling for the inclusion of the registration of the refugees in civil registers. Excluding them increases their vulnerabilities and chances of repatriation to their countries of origin or a third country. So perpetuating a lifelong sort of disadvantaged livelihood. Not only in terms of birth and marriages, there are also death registration. The women are disadvantaged, invisible, or undercounted. Adult males tend to have higher mortality rates than females, but large differentials indicate that female deaths are underreported. Only 23% of all deaths reported to WHO in 2017 have precise and meaningful information on their cause of death. In a case study from India in 2015, only 22% of the total registered deaths in India were medically certified, of which 62% were males and 38% females. In other words, the Indian government has information on the medical causes of only 14% of the estimated annual 10 million deaths in the country, and the majority of these are among males. In many situations as well, when women die, there are fewer incentives to register their deaths, especially if they have no resources to pass on. And given that women are overrepresented in the informal sector with usually no pensions or any benefits, there's no incentive for their families to register their deaths. So they're kind of in many situations invisible when they are born and invisible when they die in terms of the system. How have we at the Center of Excellence been trying to address this? There are three kind of prongs. We've gone through about this in three prongs. One is bringing visibility to the gendered dimensions of CRVS systems and securing commitment to address these. We have hosted, mobilized partners and hosted conferences in collaboration with Open Data Watch in February 2018. on the first global conference on gender and CRVS. We have since then also had a larger conference in February 2020, also with Open Data Watch and UNFPA, to move beyond discussions on the importance of CRVS systems for women and children towards securing commitment to find solutions and take actions. These and other actions we have taken are also bringing gender squarely into the global CRVS agenda. But we're also backing this up with our second prong, which is generating a body of evidence around gendered social norms and how these impact access to and use of CRVS services for women. For example, we have produced knowledge brief series on gender and CRVS, where these papers are authored by different expert groups, and all look at the gendered aspects of CRVS systems, both the challenges and opportunities for helping countries meet their national and SDG targets in support of gender equality. We have also supported research on social and cultural norms that prevent or hinder women from accessing registration in CRVS systems and the impact of these women and girls in particular. We are collaborating with UNFPA for research in this area, for example, in Morocco, Senegal, Burkina Faso, Benin, and Congo-Brazzaville. We're also, our third and final prong here is also developing and piloting assessments and monitoring tools for sex disaggregated data collection, analysis, and use, especially in settings where there's still a long way to for civil registration vital statistics systems to be complete and work well. So we have also, you can find out more about our several resources we have on our website that you can access and learn more about our work and about what others are doing. We have the library section. We have the library and the learning section, which when you visit will include a searchable library for resources developed by various expert groups, including tools, standards, and good practice material about CRVS and health information systems. And you also find a link to CRVS e-learning courses and the video series to explain the facts and about CRVS systems and why they matter. You'll also find country profiles, which is a section in the library which has an interactive map that offers snapshots of CRVS systems in various countries. We now have 12 published, and we're working to have 30 more released during this year. The Center of Excellence has also recently completed an ambitious online tool or directory of experts so that everyone who's looking for expertise can search the directory for consultants, government officials, or organizations with expertise in a range of fields within civil registration, vital statistics, and identity management. All experts and vetted, and to ensure high level of skill, knowledge, and experience. I sincerely hope you'll use these resources. They're here for your use, and we look forward to hearing from you if you have any views and suggestions. Thank you very much for inviting me to be here today.
Our next panelist is Dr. Fatima Mru, who is the Director of Health Department of Goiânia, capital of Goa State, Brazil. She's an oncologist and graduated from the Federal University of Goa. She holds a doctorate from the Faculty of Medicine at the University of Sao Paulo and is a professor at the Faculty of Medicine at the Federal University of Goa and the Pontifical Catholic University of Goa. Currently, she is the Director of the Health Department of Goiânia, the capital of Goa State.
dear Chairman, I would like to thank you very much for this opportunity to share Brazilian experience in this very important panel. Goiânia is a big city with 1,500 million people, and it is located at the center of the country. The population of Goiânia is a little bit more women than men, and around 13% are aged over 60. At present, Goiânia has 52,000 cases and 1,247 deaths, but still it is with very low fatality rate, under 3%. On the left side, we have our epidemiologic report daily since the first death case. This is our governance strategy, and we build a lot of committees, a lot of guidelines, and a lot of protocols to manage the COVID-19 disease. We appreciate very much this very nice multidimensional strategy proposed by Dr. Victor, and according to this, he considered 4 dimensions to deal with the pandemic COVID-19. And the first one is the disease itself. And in the second moment, the urgent non-COVID issue. And the third dimension is the impact of restriction made because of the COVID-19. And the fourth dimension is mainly psychological results, economic results, and we must pay attention to all of these 4 dimensions. Here is some of the actions we did in Goiânia to deal with the pandemic. First, we prepare our healthcare facilities, our workforce. We give strong improvement, the protection policy for high-risk healthcare professionals, early and quick COVID-19 identification, PCR and antibody testing, hospital healthcare support, and control COVID-19 spread. This is our healthcare network. We have 7 geographic regions, and in each of them we have a lot of healthcare facilities, primary care facility, emergency facilities, hospitals, and mental care facilities. So taking all of them into account, we have 96 facilities, healthcare facilities to receive patients. So we expand the access to the patients. Another action that we built here is about communication. We build a telemedicine and a call center to answer the patient's doubts and to guide the patient with some symptoms. On the other hand, and at the same time, we provided hospital care, and we care so much about ICU beds that it's very difficult to build these new ICU beds. And we, at the beginning, we started to provide these. So in these 2 public hospitals, we got 85 ICU beds in one of them and 34 ICU beds in another one. And more than this, we got 9 more hospitals in a total of 222 ICU beds and 206 infirmary beds. These hospitals are all dedicated hospitals for COVID-19 in order to avoid spread of the virus when we share patient with not COVID symptoms. So we provide also another hospitals with a specialized bed to receive patients with cardiovascular and circulatory disease, orthopedic disease, pregnant women, and cancer patients that these patients, when they get COVID-19, they need some care specialized. So we got some hospitals with these specialized issues. Another policy of care for vulnerable people we built for homeless people and especially for immigrants from Venezuela and other countries. Also, we started to make an aggressive testing policy to stop the chain transmission of COVID-19. So we plan to do this weekly. We started from August 5th. But how we did this? We planned to do this not in a random way, but guided from data that showed some neighborhood is increasing cases, so we choose that neighborhood to make this aggressive testing there. In here we can see in the left side one neighborhood with high number of cases, and some days later other 2 neighborhoods in increasing cases. So to these regions we direct the aggressive testing in most of patients. So we could go to all these 7 geographic regions, and we got around 13% positive cases. And the result of this was very encouraging. On the left side, we have from this period, the number of hospitalizations dropped to 15% with this action of testing aggressively. And overall population testing, we got around 15% of all population in Goiânia. And about healthcare professional and public healthcare professional, they were tested 100%. Another strategy that we developed here is a prevalence survey of antibodies against SARS-CoV-2. So we planned to do this in 5 steps every 2 or 3 weeks in a randomized sample. This is a picture of this work, usually was carried out on Saturdays. And this is the result of the 3 steps of this. Is very important results here. We can see in North region, for example, from the first round to second round, not so much difference, but from these two to the third round, important increase in number of cases of antibodies. So we can see some difference in the circulation of the virus in these regions. So we can plan some action, we can plan to do something to this region. Another important aspect we are recently looking for is what kind of people dies the most. So we can see here that people over 60s and people with some disease previously, like diabetes, like heart disease, renal, lung disease, obese people, and hypertension people. So for this special group of patients, we develop a protocol called Save Lives in 3 steps. The first step is to identify this very restricted group of risk, and to give to these patients a quick test, and if positive, they go to oxygen saturation evaluation. If lower than 95%, go to the hospital. And if oxygen saturation is okay, but the patient have more than 3 days of symptoms, we also perform a CT scan. If this CT scan shows more than 25% of injury, also the patient go to the hospital. So this early hospitalization, we expect that we can save some lives with this protocol. What are the outcomes we got until now with these strategies? Here we can see hospitalization patients, and we can see clearly a decrease in number of cases that needed to hospitalization. So after that strategy we made before. Here the same, but about deaths according to the date of death, also decreasing clearly. What are the lessons learned here? We must keep the leadership, look for solutions to extend system boundaries, key action, priority actions, and protect lives, avoiding to leave someone behind. And the future directions is be very careful and hold on until more knowledge and effective vaccine come here. Thank you very much.
Next, we will hear from Janet Mucheru, the Registrar General of Kenya Civil Registration Services and Deputy Director General of Information System Management for the National Statistics and Information Authority. She will describe recent progress and interventions to facilitate birth and death registration in nomads and populations living in remote areas.
My name is Janet Mucheru. I'm the Director of Civil Registration Services in Kenya. I'm going to make a presentation on continuation of services amidst the COVID-19 pandemic. In Kenya, half of the country is made up of marginalized areas where we have vast areas with rough terrain And in those areas, nomads live in those areas. Most of them actually are not registered. Their children are never registered. The registration of birth is around 20%, whereas the registration of death is around 10%. So the government is putting some strategies in place to ensure that the entire country move together in terms of registration of births and death. You are welcome to my presentation. I'm going to share the screen now. As I said earlier, my presentation is on the continuation of civil registration services in Kenya amidst the COVID-19 pandemic. Then I'll discuss the innovative approaches and the strategies the government has put in place to ensure that marginalized areas are taken care of so that they move together with the rest of Kenyans. The outline of my presentation is as follows. I'll start with an introduction. Then I will talk about the challenges facing marginalized populations. Then I'll discuss the experiences and lessons from the impact of COVID-19 pandemic registration services. Then I'll discuss the innovative strategies to improve access and completeness of civil registration in Kenya. Then I'll mention about resilient systems, CRVS systems in emergencies to meet the needs of marginalized and vulnerable populations. Then I'll mention the government strategies that it has put in place to ensure that the marginalized populations are taken care of so that they develop like the rest of the country. Then I'll end with a conclusion. In Kenya, civil registration services is done on an agency basis. Our agents of registration are health facilities for those children who are born in hospitals, and those who are born at home, the assistant chiefs do the registration. As of 2019 data, the coverage for birth was 75.5%, whereas for death was 38.8%. It's important to mention here that most people in Kenya, due to cultural beliefs, don't believe in reporting or registering their death. They believe death registration is for those who have something to inherit or to be inherited. As such, we have a lot of work to ensure that we educate all Kenyans to ensure all of them report the vital events, both the death and the birth of their children. Challenges facing marginalized population. First of all, the registration agents are few as compared to the populations who are supposed to be registered. So this is a challenge because in the marginalized areas, the agents of registration are very few and the area is very fast, so most of them are not able to be reached. The other problem, the doctors and the clinical officers and nurses in charge of dispensaries are also very few, and where they are there, some of them are not even trained to determine the cause of death. So this causes a problem, especially in the marginalized areas. Then we also have the problem of practice of re-reporting of causes of death by non-medically trained personnel. I've already said that for those deaths that occur at home, the assistant chiefs are the ones who report. So sometimes they don't report those deaths the way they are supposed to be reported. So, and that is a serious challenge. Then we have the other issue of widespread apathy, the one I've talked about, and lack of immediate tangible benefits of registration of births and death. People believe that there is no benefit in registering a death or even a birth for that matter. But recently for birth, we made sure no child can be immunized or go to school before they are registered. But for death, it's a bit tricky because we are not able to offer any benefit for death registration. So we are left with the option of trying to create awareness among Kenyans the importance of reporting all vital events. As a result of this, the number of those registered, the death registration is very low. I've already said it's 38.8%. And we have compared the trends registered death between 2019 and 2020, and we have realized that in 2019, the deaths registered were more than in 2020 up to July 2020 due to the COVID-19. So experience and lessons learned from the impact of pandemic to civil registration services. So one of the lessons we have learned is that there is limited mobility due to the lockdown and change in health-seeking behavior due to fear of contracting COVID-19. So the lockdowns prevented the agents of registration to report the events that have occurred in their areas of jurisdiction. Then we also have incorrect certification of causes of death due to the short time of the burial period and fear of failure to conduct a postmortem. So during the COVID-19, people are being buried within 48 hours. And in in a hurry, so the chiefs didn't have an opportunity to report any death, and so we have ended up losing some of that data. There was also a burial protocol for people who die to be buried within 48 hours, and that has made us also have incomplete data on event notification. We have thorough and incomplete registration process affects generation of vital statistics. Even our own officers, there's a time a few of them didn't report to work due to fear, and in some few areas where this contraction of COVID-19 was reported, the officers did not go to work at all. So this made us not have complete data, and sometimes even where the data was there, it took time for us to get the data. The other subtopic is innovations to improve access and complete civil registration service to marginalized populations. So during this COVID-19, there are innovations by civil registration to ensure that we continue offering services to Kenyans. So what we have done, we have increased the mobile registration. Mobile registration aim at taking the services close to the people. And as you have heard, the marginalized live in vast areas with rough terrain, and they live in informal settlements. So we drive there and register them there. And this is a bit easier for birds, but for deaths it's a bit tricky. But we have continued to ensure that registration in those areas is done, so that we capture the vital events. So in Kenya, the presence of civil registration is in only 122 stations. To ensure that we register everybody, we have operationalized additional sub-county offices to ensure that we are able to capture these vital events. We are also using mobile phones because in Kenya, almost everybody has a mobile phone. We are using mobile phones to follow up on registered events. Then we have also strengthened the link between MOH and our department to ensure that those deaths that occur in hospitals or in health facilities are reported to us to enable us to register them. Then what we also did as civil registration, because we were supposed to maintain social distance and some of our working areas are very crowded, we devised a method of working in shift where some people are working at night and others during the day. We provided transport for them so that there is continuous of service. To ensure our clients also come to our offices, we made sure that we had sanitizers and hand wash stations where everybody could wash their hands before they came to our offices. Most of our offices are also do their work manually, so we also made sure that we sanitize the records to ensure that people don't contract COVID-19. The government also have a system which they call Nyumba Kumi, where 10 opinion readers in every village, those who are respected, report on events that happen in those their areas of jurisdiction. So we made use of those so that they report what goes on in that village and any vital event that happens so that we capture the event. So we've actually made use of those Nyumba Kumi. So we have also realized the importance of resilient CRVS systems in emergencies to meet the needs of marginalized and vulnerable populations. So first of all, in Kenya, civil registration is an essential service. And when it's an essential service, it means that the government is able to provide the needed resources. So that was very important. So it's very able to continue working even during crisis and emergency. We also strengthened the collaboration with the government and the development partners to leverage on their diverse capabilities because we realized we couldn't do it alone. We are collaborating with a lot of development partners to ensure that we continue offering the much needed service of capturing and registering the vital events. We have also realized that many Kenyans are ignorant on registration of births and deaths. So what we have done is continue engaging them and telling them the importance of registering these vital events immediately they occur. We have also activated mobile registration services among us the marginalized and the vulnerable population. I think I had already mentioned that, but this is a way of making CRVS resilient to any emergency. The government has also put some strategies in place to improve civil registration and vital statistics systems to provide timely and quality mobility and mortality data. The government has partnered with Google to provide 4G internet across the country because we have learned that some of the services can only continue if there is internet. So this is not just for civil registration, but also for schools because some children are learning at home. So this has really helped even in the marginalized areas. And the mobile phones are also working because there is internet in those areas. Then the government has also come up with a strategy of operationalizing new registration offices to bring services closer to the people. So before we were in only 122 stations, and I think now we are going to operationalize an additional 228 offices so that across the country the service is close to the people, especially the marginalized. Then the government is working very hard to ensure that we have a fully automated end-to-end registration system that is going to help us reach each and every person, even during emergencies like the COVID-19, because we realized that we didn't have all the data we required because we don't have 100% coverage. So end-to-end automation is going to enable us, it's going to help us improve on coverage of, especially on death, which is currently only at 38.8%. Then we have realized the re-reporting of chiefs, and to help them determine, also report properly the cause of death, we've integrated verbal occupancy during notification of community deaths. We have also embarked on training of registration agents, both at the MOH, on medical certification and coding of cause of death. I think those strategies the government put in place are really going to help make civil registration resilient and able to tackle any emergencies like the COVID-19. And then we have agreed that as a department, we are going to continue sensitization campaign on the importance of civil registration, so that those who don't know the importance of civil registration can come to appreciate it and start registering vital events immediately they occur. We will also continue with the mobile registration. We will also do a lot of monitoring and evaluation to know where we are weak and areas which are registering less vital events, so that we can improve in those areas and concentrate more resources in those areas. We will also continue strengthening the partnership for both technical and financial support with the development partners, because we realize we cannot do it all. That is the end of my presentation. In conclusion, I'm saying that a well-functioning civil registration and vital statistics system helps generate accurate and reliable data for informed decision-making, especially regarding marginalized and vulnerable groups. The system has not been equitably distributed in Kenya, and the new experiences during the COVID-19 pandemic have helped realize new approaches to improving access to and completeness of civil registration. Thank you very much for listening to my presentation. So that's the end of my presentation. You have heard what is happening. There's a lot of inequality when it comes to reporting of vital events in Kenya. So this country is concentrating more now on the marginalized and vulnerable areas, so that we can improve on the coverage to 100% in these areas. Thank you very much.
Following the individual presentation, there will be a discussion among panel members, moderated by Dr. Philip Settle, who directs the Civil Registration and Vital Statistics Program at Vital Strategies, and leads the organization's work to empower governments to count every life and use data strategically to target resources and policies. He will remind us that civil registration is for all people, including refugees, migrants, and minorities.
Thank you, everyone, for joining us on this important panel discussion about making the invisible visible in the context of COVID-19 and civil registration and vital statistics. We have a panel discussion now with our presenters, and I would like to introduce myself, Philip Settle of Vital Strategies, heading the Civil Registration and Vital Statistics program there. You've had introductions to our individual presenters in their presentations. We're joined by Fatima, Montasser, and Janet. And I would like to kick things off, Montasser, by saying asking about the barriers that you mentioned in terms of vital registration events, and particularly those that affect women and children. Do you have some advice for beginning to overcome these barriers?
Thank you very much, Philip. Indeed, there is advice, and it is based on evidence. And maybe this is what I would like to start with, is that because there is no one-size-fits-all solution, so we need research to identify what are the barriers in each setting and what are the appropriate solution in each setting. So, for example, I talked in my presentation about legal barriers. So I would say this is a pretty good starting point for governments to look at the legal barriers, for example, that prevent women, registration unless there is a man present or a male figure present, whether it's a father or an uncle or something, that prohibits or hinders the registration. We've also talked about the socioeconomic barriers and the logistical barriers. The further the registration centers are, the more difficult it is, especially for women to travel to them. So one way to address this for governments is for example, to allow for at least birth, for example, in case of birth, to allow for birth notification at health services. So there's no, so it makes it easier for women and families to register their birth. Many countries also, several countries have actually also started some very creative solutions linking social protection policies, cash benefits for vulnerable populations to registration. So at the same time, it makes the delivery of those services more efficient, but it also and targeted to the right people. But it also is a way for vulnerable populations to access those services. So there are a number of solutions in the hands of governments in particular to allow for this. But I just maybe conclude by saying again, there's no one size fits all. The solutions have to come from within the context where the problems are or the obstacles are.
Janet, Fatima, do you have thoughts about that question, and particularly in relation to the vulnerable populations or the structurally disadvantaged populations in your countries?
Thank you, Philip. I think in my country, the problem that women face is they can't make decisions alone. Decisions are made by the men, and sometimes men are not available to make those decisions. So the women have to wait until the men are available to make the decisions. Otherwise, if they make the decisions without the men, the decisions will be overturned when the men arrive, or they will be violent.
Fatima, what about a Brazilian perspective on this question of opportunities and challenges facing either women in particular or other marginalized or disadvantaged groups?
No Brasil também grande desafio esse grupo de pessoas vulneráveis.
Challenge with disadvantaged people, and especially women. They are victims of violence and growing numbers. And we're seeing this happening in these situations, in this pandemic situation. This vulnerability has increased, has made them even more fragile, not only women, but children, and also elderly people with elderly who in a homeless situation. So it's a great challenge to public health.
Thank you. You know, one of the themes that I think came out a bit in Janet's presentation and also in Montesur's remarks is the importance of innovation and research. Are there specific areas or questions that, from your vantage point, keep you up at night when it comes to understanding how to better provide civil registration services to people who are not able to access them or who are not accessing them for behavioral, cultural, or structural reasons of inequality. Are there some big research questions or innovation questions that you think would be helpful to focus on? Welcome to start. Fatima, do you have some thoughts about areas of innovation or research in the context of COVID-19 and improving CRVS, civil registration for disadvantaged populations?
Eu acho que com a pandemia nós precisamos.
I think with the pandemic, we need to search for this as a legacy. And besides these groups, we have immigrants as well. Immigrants in Brazil, we have this matter of, in our city, for example, we have a great amount of people who came from neighbor countries, and they are kind of without papers, they're clandestine with no homes, proper homes, and with no health service. As this became evident with the pandemic, maybe we have the opportunity to make them legitimate and transform it into a procedure.
Thank you. Janet, do you have thoughts about innovation in the context of the program that you are responsible for?
I think about it many times. Sometimes it's very difficult because some of those women and who live in the marginalized areas, there is no internet. Even reaching them is a problem. Even their priority is not registration. They have other priorities because they have to go look for food and look for water for their families. So I keep thinking what can be done so that we can make sure that those women are registered and they see the importance of registration, and also help them solve some of those social problems so that they see registration as part of importance so that they develop. Otherwise, they don't see the importance because some of them their children don't go to school. Their husbands are nomads, so they move from one place to another. Even sometimes when we give them these registration documents, they lose them. So it's a tricky problem in Kenya among the nomads.
Thank
We
you.
also have, yeah.
Oh, please continue.
I wanted to add also we have some areas where we have slums, very big slums, where we have people who live in those slums, and those people also don't even know the importance of registration because they can't even afford to take their children to school. And even health care, sometimes we catch them and we register their children when they take them for immunization. But still, for that is also, for them, they don't see the importance. We really have to think of a way to make them see registration as importance in their lives. And you see also the right for death registration, they don't see the need for registering death because they associate death with registration with something you benefit from. So maybe they think they have nothing to be inherited. So if there is nothing you get out of death registration, they don't bother talking about it or registering it for that matter.
Thank you. And Montasser, from the international perspective, where you sit, what would you say some priority areas of innovation or research might be that are thrown up by the COVID pandemic and the challenges of particularly vulnerable populations?
Thank you, Philip. Just maybe to build on what was already said, I think there needs to be, I think there is a lot of room for innovation, both from the supply side to make services more welcoming for people and easier to access, but also there is room for innovation and finding new ways to attract, to make it attractive, to make it meaningful especially for vulnerable populations. So to register and make it possible for them. In terms of the just looking at COVID-19, for example, the situation we're in now, where many countries many countries did stop registration altogether, even not sometimes notification. And many countries are now struggling to catch up again with those missed registrations. So we really need to find, and we're in the Center of Excellence, we're working with some of our partners to find good practices and solutions to build those systems to rebuild or to strengthen the systems to make them more resilient to handle crises, whether it's a humanitarian crisis with a lot of displaced populations, slum communities with kind of sort of perpetual increase of number of people who are not registered. These are all, and of course, disease outbreaks. These are all situations that influence people's ability to register and government's ability to continue for the continuation of services for registration. It is an essential service. People are born and die every day and get married even under the most difficult circumstances, to form families. And so this is an essential service. It's not optional. Governments need to really, and researchers governments need to find ways to operate, to continue for continuous operation, and researchers need to help governments to find the most locally or context-specific solutions to make this to inform government decisions and policies in this regard.
Thank you, Montesor. I'm glad you mentioned this issue of civil registration as an essential service. I noticed that it is an essential service in Kenya, if I'm not mistaken. And I was wondering, how did that come about? Was it a challenge or a strong advocacy position that you needed to adopt, or were people in government fairly supportive of ensuring that these services continue during the pandemic?
In Kenya, civil registration is an essential service. We continued working. And the support wasn't there. Actually, I had to reach out to UNICEF and some other development partners because I think the government had a bigger problem than just assisting civil registration. So I reached out and I was able to get the protective gears. And then my officers, some of them work in a very big hall like the clerical officers. So we devised a method of working in shifts. Some were coming at night, and I told them this is an opportunity to clear the backlog because before that time in the capital city, we had a very huge backlog because before we had a lack of registration materials. So I told them, since we have the materials, let's take this opportunity, but take care of ourselves. We had to keep the social distance. So that's why we agreed that we would work in shifts, and we continued that we are happy. We are happy that we did that. Because right now we don't have a backlog, and then we continue registering and telling people. We even went through the social media to tell people our services are continuing and they need to come.
Thank you. And Fatima, I don't know if you have a perspective on this particular question from Brazil, the matter of civil registration as an essential service.
Yes, I understand this as an essential and challenging service because lots of people, they do not give the value, the proper value. And I've heard from you, your thoughts. Maybe one of the things, most difficult things, it's to the government to create some attractive linked to these people, vulnerable people wishes, as you've mentioned, something attractive to them, to link this benefit, to link some benefit to the registration, because the benefit the registration will bring, it's not immediate, and people are not aware of that. and our situation of vulnerable people. So Brazil, we have a very extended slum reality, and well, although the government do not recognize it, so we have a million and 1.5 million inhabitants. We don't have slums here in my city because we have a history of building well, but the most vulnerable people here, they are these people who are victims of violence, domestic violence, and we are for an entire year we've been developing a municipal policy to children and women protection. So domestic and also external violence, and also self-caused violence.
Thank you. I think we're coming towards the end of our panel discussion now, and I wanted to look towards the future again and just ask if you think there are lessons that you have learned in the year to date of the pandemic that have implications for you in thinking about the resilience of civil registration in the future against perhaps future public health emergencies. Janet, would you like to start with some reflections on that question?
Okay, yes, thank you. Thank you, Philip. We've learned a lot of lessons. For example, we've learned that it's very important to work with others, development partners. We've continued working with them. And through their support, we've been able to continue working and serving the public and registering births and deaths. We've also realized the importance of automation, because if we are automated, even the hard to reach areas would be able to reach our services. So we are working very hard as a country to make sure that our services are automated. We've also realized the importance of ensuring that the entire country or the public are able to reach services of civil registration, because some areas have very low registration, whereas others have over 80%. So we've realized that it's important to reach out those areas where registration is very low, so that registration, the country can move together in terms of coverage. We've also realized that women need to be supported, because in Kenya, mostly men feel like registration is upon a responsibility for women. So we feel women should be supported so that they continue doing registration, and also create awareness to the men so that they can support the women in registration. I think that's what I can say for now.
Thank you.
Yeah.
Fatima, perhaps you have some thoughts about this question.
Yes. Well, about civil registration specifically in Brazil, it's not a so problematic issue, thanks to our public health system that is strong, and we have 30 years. It's called SUS, and this pandemic showed very clearly that this public health system, it's very relevant, because that's this service that attended to the pandemic issues much more than the private insurance area. So civil registration itself is not so problematic due to this unique health system called SUS, but it shows us mostly that the public health system in Brazil, it's very robust. It brought this assistance in keeping equality one of the pillars of our public health system.
Thank you, Fatima. And Montasser, do you have some reflections on this question?
Thank you very much, Philip. I think, the rest of the panel really made some great points. I think the only point left for me to really maybe emphasize is the point about the lessons learned this year from COVID-19 in terms of death registration. it was civil registration that revealed early on sort of the magnitude of excess death in European countries at the time. Of course, their systems are advanced there, but that allowed, that sort of really opened the window to really to understand and to value how civil registration is important, especially in times of pandemics like this. WHO, one of WHO's reports this year, stressed that there's no low-income country that can produce comprehensive death data from civil registration systems. The systems are very weak, unfortunately. Maybe COVID-19 is the time, the silver lining is that it really puts emphasis on the importance of civil registration to allow for better statistics, for better planning in relation to causes of death, for example, during a pandemics and disease outbreaks. So this would be my departing message, I guess, so to speak. Thank you very much.
Thanks so much, Montasser. I'd like to take the opportunity now to thank you all for participating and listening in on this important conversation, to thank all of the presenters, those who are able to join us on the panel, and those who were not able to join on the panel. Thank you very much for your important contributions. And I wish everyone an enjoyable rest of the World Data Forum. Thanks again for listening.